So that first visit back after somebody's been started on LonSurf TAS 102, is that day 15 or day 28 for you?
Usually day 15.
Yeah, and you're doing a CBC, so it's right after they finish their first 2 weeks, and they need a CBC then anyway. And so a typical visit is a CBC, quick physical exam, typically not a lot of side effects. If they've had nausea, we've heard about it already by then. Any tricks on managing the nausea for the LonSurf, because it is continuous treatment?
Usually people that I've found are fine taking Zofran. Works
So
pretty well.
Typical stuff that
Yep.
we use for that. Any other tricks on that first? How about the use of growth factors on day 15? They come in, their ANC's 300.
I like to wait a month until I see how's he gonna behave. But I shy away from using the growth factor in the first cycle. But if this keep happening and I end up delaying the start of the cycle, I might lean towards starting growth factor.
Yeah, and I think it's important if they come back with that first round of myelosuppression at day 28,
Yeah.
and the counts are still low. The recommendation, and pretty much what I do is I delay a week. You might be able to get around with the same dose the second cycle, because you do want to get them through those first couple of months to see if they're going to benefit from the treatment. But then if it continues to delay, then either growth factor or dose reduction, right?
Yes. Well, one thing I like to mention, especially when you start the medicine on patients, especially in younger adults, a lot of them, even if they don't ask the question, they wonder about pregnancy, about even the relationship with their spouses. And some people ask that, is that going to affect me? And intentionally, even if they didn't ask, I like to bring it in the discussion to make sure at least this has been addressed during the visit.
What's the answer?
So we tell them, of course, you should not be pregnant or get pregnant while you're taking the medication.
Absolutely, but how about just regular sexual activity?
I say that's fine.
Something I always tell my patients is that I would rather them over-communicate than under-communicate. Sometimes people tell me they didn't want to tell me something, they thought it was insignificant, but that's why I'm here, that's why I have this role. So even if you think it's nothing, I just want you to at least, I tell my patients, at least shoot me an email, give me a call, let me and the physician decide if it's nothing or if it might be something that can turn into something bigger later and we can stop it before it becomes a problem.